On the flip side, are there things that you see that parents don't realize can land their child in the urgent care or ER?
Probably the number one thing I see is, unfortunately, where parents are smokers or there are smokers in the home, and that creates an environment that's certainly going to get kids into trouble. Generally speaking, most parents who've got kids who have asthma and those kids have been evaluated are pretty much with the program. It's pretty rare. I mean, parents are really great. Once they learn about the disease and once their child has been living with it for some period of time, they generally figure things out, and they're usually pretty good about intervening early, trying to prevent bigger problems. And once they do end up in the emergency department or the urgent care, those are the parents that I find more often than not are really well educated, and they've done all of the things that they can do at home, and now it's time for some professional help. But going back to the smokers, the other issue is that a lot of times I'll hear parents say, well, I don't smoke in the house, which is certainly better than smoking in the house, but even the smoke, the smell of smoke on their clothing or on their skin can be an irritant that's enough to trigger an asthma attack in some kids who are really sensitive. So, that's probably the number one thing that we see, particularly in my line of work, where people and kids do get into trouble with asthma, and that is that exposure.